Another thing you want to know is you'll receive a copy of the recording and a copy of the slides, and I'll send you an email with links to all the resources we're talking about today. So don't worry about writing anything down and saving the chat. So you'll get all of that information. I invite you to ask any questions you have, either by using the chat or the Q&A feature, and we'll be sure to have time to address those at the end. So here's what we're going to talk about today. First, I'll give you a brief overview of NRC RIM and our work to engage refugee and immigrant communities more generally in public health initiatives. Then Jasmine from the Washington Department of Health will give sort of a state and national perspective on Ukrainian new arrivals before her colleagues go over some of the capacity building activities that they have worked on in their local communities. And then Olga from the Nashi Health Board will go over her organization's lessons learned. So first, a little bit about us. NRC RIM is funded by the CDC and housed at the University of Minnesota. And while we were initially established as part of the nation's COVID-19 response, we now support health departments and community organizations working with refugee, immigrant, and migrant communities that have been disproportionately impacted by health inequities of all kinds, not just COVID-19. We do that by strengthening partnerships between health departments and communities and by supporting the organizations that are working directly on the ground with refugees, immigrants, and migrants with the ultimate goal of improving health equity. We support organizations by collecting and disseminating best practices, health communications and health education, and by offering online training like this. We also have technical assistance and a few other services. One of the projects that we've worked on that's of particular interest to this group is Settle In. And so this is a partnership between IRC, CORE, and us. And so what Settle In is, it's a platform through which refugees and immigrants can access information about a range of topics related to resettling in the United States. And so there's a Facebook page, a web page, and an app. And it's been around for a couple of years now and has historically mostly supported Afghan communities, but they just expanded to include Ukrainian activities as well. And so we work with IRC and CORE on all the health-related content that is on this app. So as I mentioned, we were initially established as part of the COVID-19 response, but moving forward, we're going to be continuing our COVID work on a smaller scale while focusing our efforts on the public health needs of Afghan communities, as well as providing information to Ukrainian communities on health requirements for parolees. And through our work so far, we've learned that involving communities you serve in your planning and decision-making practices really makes a difference. Members of any community know best how to communicate with their peers, which is why we advocate for community involvement as a central element for any public health response. So I know that we're going to talk about we're going to talk about barriers, we're going to talk about challenges, but I also want to remind folks that RIM communities have a lot of strengths that they've used as part of the public health response in their own communities. And so we wrote a blog about this recently. We know that communities have addressed systemic inequities by providing for their peers' basic needs, like by organizing food pantries. We've seen community leaders create culturally relevant messaging in a language and format that their communities understand. There were even informal contact tracing efforts at the beginning where people would self-report or self-notify their close contacts because they were concerned about the spread of COVID-19 in their greater community. And these are just some of the ways that communities have really lifted each other up during the pandemic. We know that when organizations and health departments collaborate with community leaders on efforts like this, it can make their impact even stronger. We have a community engagement toolkit with a lot of ways organizations can partner with communities, which you can see here on the screen, some examples. But one community engagement effort that we've seen really successful in Washington State and elsewhere is the establishment of community health boards. We have resources on our website to help any organization with the recruitment, facilitation, and sustainability of boards like this. We'll talk about health boards more in just a moment. So with that, I'm going to introduce today's speakers. Vadim G is a health educator who's finishing a master's degree in community medicine. He immigrated to the United States from Ukraine as a refugee in 2002 and grew up in Portland, Oregon. His work at the Washington State Department of Health involves managing toolkits and health information material, translating and editing vaccine information, and assisting with the former Soviet Union vaccine outreach program. Vadim K. is an immunization health educator and manages the vaccine outreach program for former Soviet Union communities at the Washington State Department of Health. His background is in infectious disease epidemiology, health education, and community health advocacy. Vadim immigrated to the US as a refugee from Moldova and grew up in Chicago. Now, Jasmine is a program manager of the Washington State Department of Health Refugee Health Program and serves as the State Refugee Health Coordinator. She works with local, state, and federal partners to improve health outcomes with resettled refugees. And finally, Olga is the co-founder and director of operations for the Nashi Immigrants Health Board, a nonprofit organization for Ukrainian and Russian-speaking communities in Washington State. So I hope you will join me in welcoming them. I'll pass it over to Jasmine.
Thanks, Sarita. Just as a note, I don't think that the video is working right this moment. Next slide, please. So we're going to talk today in my section just about a little bit about refugee resettlement in Washington State, a brief overview of the Uniting for Ukraine program, and then a little bit about immunizations and up-to-date for age status. Next slide, please. We live in such an interconnected world, and Washington State is home to many globally connected communities. When we talk about health in our state, we're focusing not just on what happens within an individual within a doctor's office, but really the bigger picture systems, experiences, and factors that allow people to thrive as they live here in our state. For newcomers to our state, such as refugees, this is built on partnerships between local communities, health departments, primary care, community-based organizations, and so many others. These relationships have really been foundational throughout the course of the pandemic and throughout our work in health. This local collaboration and communication facilitates coordinated care and improved health outcomes for all of our globally connected communities. Next slide, please. So this slide shows the number of refugee arrivals and folks coming through the U.S. refugee admissions process to Washington State between federal fiscal year 2010 and 2021. And since 1979, Washington State has welcomed refugees who fled persecution in their home countries to rebuild their lives in our local communities. Over the past 10 years, refugees from over 30 countries have resettled in Washington State through the U.S. Refugee Admissions Program, including many newcomers from Ukraine who are shown in the green color on this chart. Next slide, please. On April 21st, 2022, President Biden announced the Uniting for Ukraine program, also known as U4U, which is a new process to provide Ukrainian citizens fleeing the war opportunities to come to the United States. Ukrainians participating in U4U must have a sponsor in the US who agrees to help facilitate their arrival. Through this program, a supporter in the US files an application on behalf of a beneficiary abroad. Once the supporter and beneficiary complete the requirements of the application process, U4U beneficiaries are approved to travel to the US. As of January 3rd, applications have been filed by supporters for over 194,000 people, and over 101,000 people have arrived in the United States. Washington State is ranked number 4 nationally for the number of U4U supporter applications that have been filed. Next slide, please. Data from our state's Department of Social and Health Services is shown here, and this is really our indicator of how many people have arrived in Washington State. This map shows the number of Ukrainian new arrivals who've accessed cash, food, or medical assistance in Washington State from January to November of 2022. 13,625 Ukrainians have accessed benefits during this period. And as you can see from the map, there are some counties which have welcomed large numbers of Ukrainian newcomers this year. We've also seen new arrivals resettling in a broad range of counties throughout the state. The number of arrivals and the geographic diversity of where people have been going has presented a unique challenge. The community-led outreach work, which my colleagues will share more about, has been really critical in ensuring that public health information is available to our newest members of our communities. Next slide, please. For newcomers to Washington state, such as refugees, recommended health milestones typically occur within the first 90 days after arrival and include enrollment in health insurance, completed a domestic health screening examination, and accessing primary care. Next slide, please. One of the roles of public health really centers on using data to help understand health needs. Our team has heard clearly from community partners over the years that more granular information is really critical to this process. The Washington State Refugee and Immigrant Health Program conducts routine program evaluations using the refugee health screening data that I referenced before, and this includes immunization outcomes. As part of this evaluation work, our team developed a summary of health outcomes observed among refugees from Ukraine who resettled to Washington state between October 1st of 2015 and September 30th of 2021. The pediatric profile reflected data for over 2,200 children who resettled to our state during this period. Next slide, please. So this chart shows a summary of the proportion of children who are up to date per ACIP recommendations at the time of their arrival in our state. And as you can see, the coverage varies pretty widely, from 0% for vaccines like HPV and meningococcal, up to about 75% of children who are up to date for MMR at the time of arrival. Clinicians in refugee health screening and primary care partner with families to provide necessary catch-up doses to clients after arrival. Evaluation data and feedback from community partners and clinicians has noted longstanding community concerns regarding vaccinations, and immunizations have been a key area where families really need information and support from public health regarding information on vaccine safety and effectiveness, immigration requirements, and school requirements. Community-led public health work has been critical in sharing information as we've continued to welcome large numbers of new arrivals to our state. So I'll pass this off to my colleague, Vadim.
Jasmine, thank you. Thanks for that presentation. As Sarita introduced, I'm Vadim Kogan, and I'll be talking about outreach to these communities specifically. Next slide, please. So as Jasmine had shown you, vaccination rates in these communities are significantly lower than the general population of Washington. This project that we've all been a part of started really in earnest in 2019, responding to a measles outbreak in Washington that had occurred in the Ukrainian community. So one of the major questions we had back in 2019, even before COVID, was why are vaccination rates significantly lower in these communities? Next slide, please. So we had focus groups and key informant interviews done, and we learned a few key things from those sessions. One was that the community, some community members were dissatisfied with healthcare providers due to language or cultural barriers. There weren't that many Ukrainian-speaking or Russian-speaking providers in the state, and it was difficult to find appointments with those providers. There was a fear of vaccine-related adverse events, especially in children, and multiple vaccines being given simultaneously, faith-based fears, suspicion of corrupt medical governmental authorities, and we'll be touching on that later on. There is a good amount of mistrust in the community around governmental authorities, and I'll be talking later about how we worked that into the planning of the work that we were doing. And these are all examples, but ultimately I'll be talking about key takeaways for you to be able to use later in your outreach work with the community, even if it may not be vaccine related. We had community leadership with issues around vaccinations, not condoning vaccines. And then finally, once COVID had started, a lower adoption of COVID-19 prevention practices overall. Next slide, please. So there were three key barriers to vaccination that we had determined from these key informant interviews and focus groups. One was the issues around care. So as I said before, a lack of culturally and linguistically appropriate care from health providers, resulting in low levels of health access from the community. Another main barrier was language. There really wasn't very much translated material, especially in Ukrainian, but also in Russian, available for these communities. One of the first things we did was translate many materials that were already available in English and Spanish into these languages. And then finally, trust. Because there was a lack of existing relationship between public health and the communities felt that decisions were being made without their input and that their voices weren't heard in places where decisions were being made about their health. Next slide, please. So what I know now from the work that we've been doing over the last few years is that these barriers that we found out really went beyond the scope of vaccinations or COVID-19 for the community. And by addressing them, we ended up creating structures that would transcend COVID-19 and vaccinations, things that the community needed that weren't available. Those barriers were exacerbated by inadequate health outreach and education that were done in the past. The community really didn't have much outreach done towards it from other organizations, and that further fueled that mistrust, that alienation from public health. We ended up building a close network of Ukrainian community leaders, and we helped them build their outreach capacity and connect them to public service agencies. I'll talk more later about how we did that and recommendations for doing that in the future. That connection became critical to addressing other community concerns, especially after the start of the war in Ukraine and the refugee crisis that happened later on that Jasmine had touched on. Next slide, please. So 3 questions to organize our project, and I'll go through these questions. This is how the presentation will be organized. So we'll be addressing each question in this presentation. First is, how do we ensure the communities have access to accurate and unbiased health information? And our project really focused on former Soviet Union communities, but once the war in Ukraine started, we did shift over to addressing Ukrainian refugee concerns. The second question was, how can we ensure patient care and vaccinations are given in a culturally appropriate way, and patient-centered way? And then finally, how do we build trust with the community? And how do we address that historic lack of having a seat at the decision-making table, that alienation from public health authorities and governmental authorities that people were experiencing? Next slide, please. So these are our local health participants and partner organizations. You can see the partners on the right-hand side. The top half are community-based organizations. The bottom half are organizations working with refugees. These are the totals across the state that Jasmine had touched on. My data is a little bit older, up till October, so we only had about 12,000 Ukrainians that arrived in Washington, fleeing the war and had accessed public services. So our project partners with 5 LHJs, and they're the ones that are highlighted here, are local health jurisdictions, county health departments. They represent about 91% of the entire former Soviet Union community of Washington state, and about 90% of the Ukrainians displaced by the war. Next slide, please. So the first question, how will we build trust with the community? Well, there were a few things that we ended up doing that I'll talk more in detail about later. One was onboarding a community coordinator for each of those 5 county health departments. Another was convening those trusted community leaders, including the coordinators, in a former Soviet Union work group to help us understand the priorities in the community and kind of steer our work. And then the last was helping the community create a health board to improve capacity for health outreach. And Oля and Vadim will be talking about the health board later on in this webinar. Next slide, please. So community coordinators. I think this is one of the key things that we did to improve our outreach with the community. It's still been one of the best decisions we made in our work. Community coordinators are leaders that were hired full-time at each county health department. They respond to health-related issues in their communities. At first, they dealt with COVID and vaccine information, but later, once the refugee arrivals started coming, they organized community events, health fairs, vaccine pop-up clinics for refugees, refugee support groups. They recorded radio programs and podcasts, drafted health guidance for us, helped us draft new guidance. They provided guidance to organizations that were aiming to work with new Ukrainian arrivals. And then finally, they connected those arrivals to the organizations that can provide them the resources that they needed. And so this is one of the best investments we ever made into community capacity. Next slide, please. A few takeaways, key recommendations for you in this work. One of the things that I would strongly recommend is to hire community coordinators if you have the budget for it, and ensure that they're from the community themselves. The Ukrainian refugee community and the former Soviet Union community in general are pretty insular. And so it's really crucial to access existing networks to be able to start working with community leaders that are there, especially communities that have historical trauma and mistrust of government agencies like this community. What we noticed is counties that hired coordinators from the community were able to engage more effectively with leadership, hold more community events, and better use funding more quickly as well. So Final recommendation is establish funding for full-time staff at each local health jurisdiction or in your organization that are going to be doing outreach for the community, and ensure that they're from the community themselves and have that network. Next slide, please. These are examples of events that were organized by our community coordinators. Resource fair distribution event in Tacoma Pierce by our Tacoma Pierce coordinator, another resource event in Tacoma Pierce as well. A youth group that was organized by Nashi Immigrants Health Board and Seattle King, and then another event on how to become a sponsor for Ukrainian refugees for Seattle King as well. Next slide, please. So a work group, how do we organize the work overall and get community input? Well, we convened the community coordinators at first, and every funded partner we had, they guided us in our vaccine outreach and messaging. And then the coordinators themselves, as they were onboarded, started to leverage their networks and invite new people, new community leaders to this group. And that's really how this group ended up broadening, and how we ended up getting new input into the work that we were doing and new partnerships. One of the major things that we learned that I could convey to you is we shared vaccine and COVID data provided by the Department of Health, provided by Jasmine's department, with community leaders to show them that there was this issue. We had low levels of vaccinations and high mortality and hospitalizations from COVID-19 in its community, disproportionately high. And so that helped us find people that had shared interests and complementary resources to the work that we were doing to broaden the scope of the work and help it along. Those community leaders helped us understand community health needs, not just my department, but Department of Health in general, especially as the arrivals started coming in from the war. They also assisted in data collection, helped do key informant interviews and surveys as well. Next slide, please. So key recommendations for the work group. One of the main things is help elevate community leaders into decision-making roles. Have structures available so that people can share their voice with you. They'll feel connected, and it'll help address some of that mistrust. That'll also further the impact of your public health efforts. Another is intentionally building relationships with community members. Recognize that establishing trust takes time and is based on reciprocity. So go beyond just asking people for their advice. Show them that you're acting on their input. Involve them in the planning process of the work that you're going to be doing. Don't ignore them when they're telling you there's a community issue that is serious and that needs to be addressed. Leverage existing contacts, as I talked about before. Use the contacts that your community coordinators have, or the people that your community liaisons have that you're working with, to build new relationships. That often is a prerequisite to meeting people. As I had said before, don't dismiss community needs. And then finally, if you find that there is a specific need in the community, don't ignore it. You may be the only connection people have to services. Make sure you refer people to the right place. Don't say this is outside of my scope of work and I can't address it. This is one of the major ways to build trust with community members like this. Next slide, please. These are examples of interviews and events that our work group members have done. There's an interview with Andrei Shubarkov. He's a immunologist and a professor. Another one, Stella Ivanov, an Ask a Doctor session with the Ukrainian provider, Dr. Odorich, and then an official radio program with Anja Baranovna, who is a immunologist who's being interviewed on COVID-19. Next slide, please. So the second question, how do we ensure communities have access to accurate and unbiased health information? Well, one of the things that I mentioned before is translating that information, making sure it's available to people. And not just on your website, but in a way that people will access. And so that's what led to our community media outreach partnership. We offered short-term grants to local Slavic newspapers, magazines, and radio programs to help us co-create materials around COVID-19 and vaccines and share that material with the community in a way that they'll actually engage with. We weren't getting very much engagement on our governmental websites, but this is a way to ensure people can actually see it. One of the other things is to serve as a resource to other organizations. This is what we did for input on translations, making sure the translations are quality, put together in a good way and are accurate. We'd gotten a lot in the beginning when we formed our work group, input on, hey, this translation isn't very good, or there are these issues in this flyer. And then finally, we put together an outreach toolkit. That's a toolkit for anyone doing outreach with the community around COVID or vaccine issues. We translated everything to Russian and Ukrainian. There are videos, interviews, outreach guides, health information as well in that toolkit. Next slide, please. These are examples of materials that were put together that are in the toolkit right now. Interviews with community members. There are articles on the right-hand side from one of the newspapers that we had worked with and magazines. So all translated. Next slide, please. So finally, how can we help ensure patient care is given in a culturally appropriate and patient-centered manner? Well, we put together a training for providers on cultural competency when it comes to vaccine confidence for COVID-19. We're working on a training right now around Ukrainian arrival health issues for providers as well, to help understand the different barriers and issues people are arriving into the United States with when it comes to health. So we also recorded Russian-speaking provider Q&A videos. That's something I showed on an earlier slide. And then we made sure that the community coordinators were using that health information and providing it in community-centered spaces, places where people can actually encounter it. And then finally, something that Vadim, the health board, had worked on is putting together a list of providers, of Russian Ukrainian speaking providers in the state of Washington for new arrivals, organized by their location and by their specialty. So that's something that we found that people needed and something we want to provide. Next slide, please. And this is an example of the training that I talked about. So different steps, case studies for people based on different issues that you may encounter as a provider. And so we put that together in a partnership with Within Reach and some of our other community partners. Next slide, please. So community health boards. One of the key things that we've done in terms of our outreach, we'll talk more about that later on, but as a general definition, community health boards are led by community members who are health professionals. Those boards provide their communities with a trusted resource for health information and guidance when there often is not one. They're independent of government agencies. And ideally, since they're made up of providers that are also from the community, they can grasp the cultural and health backgrounds of the issues affecting their communities. There are 15 community health boards serving most major immigrant populations of Washington state. The Somali Health Board was the first. We had met with them and discussed with them how they did this and what their process was. I'll talk more about that later. Their priority is educating the community, especially when resources aren't available. And finally, they provide a forum for their communities to advocate collectively for their health needs to their governmental agencies and social service agencies. Next slide, please. So why did the community need a health board? Well, we originally wanted to contract with the Slavic organization to create COVID-19 guidance information and share it with the community, but we realized that an organization like that didn't really exist, at least not one that was formed from the community itself. So we ended up realizing that this community, the former Soviet Union community, Ukrainian refugees included, was the third largest immigrant population in Washington and the largest without a health board type organization or without a health advocacy type of organization. So the community we knew was mistrustful of government agencies. And so there was low engagement with government sources of information. We needed a place where people could access information that they actually would trust, and there really wasn't a partner there. So we decided that we take a step back and fund capacity building in the community first and foremost. Let's see if we can help create this board. And as we talked to the work group about it, they agreed and they decided they would create this health board. And with the help of some of DOH's resources, they founded Nash Immigrants Health Board in the summer of 2022. Next slide, please. So the war in Ukraine has had a pretty profound effect on the community. We've had a large influx of refugees that have strained refugee resettlement organizations and our structures here. There's a large demand for health providers speaking Ukrainian and Russian, especially mental health, a demand for affordable subsidized housing, food, work authorizations, translated guidance on resettlement resources. At first, refugees had difficulties finding organizations with the proper resources to assist them. And because we didn't have a health board, there really weren't that many community representative groups that people could turn to for that type of guidance. Next slide, please. So when this had happened, we started leveraging this network. Stuff that we thought would be vaccine related only ended up being really helpful as we were trying to get resources to people fleeing the war and coming to the United States. Every community coordinator that we worked with, all 5 were Ukrainian, and all of them were affected by the war directly. That just happened to be the case. Several of our coordinators served as sponsors for Ukrainian refugees, or family members that were fleeing the war. And so my meetings with them, our meetings with them, ended up centering on the humanitarian response to the war. What could we do to help refugees? People are affected by this directly. We started partnerships with DOH, Jasmine, and DSHS, the Department of Social Health Services, to plan large refugee resource events. And we ended up organizing dozens of those events since February across all 5 counties, serving thousands of refugees in the process, leveraging this network. Next slide, please. So the work group, the only Slavic work group in the state, the media leaders within that work group created a Ukrainian refugee resource guide. They published it on all major Slavic media outlets. They created a Ukrainian vaccine record translation guide for school nurses and providers. The work group partnered with the refugee coordinator to invite members to the state's new Ukrainian welcoming task force. So we were able to get a lot of health leaders into that task force to better advise us on what we should be doing, where priorities should lie for Ukrainian outreach and resources needed for refugees. Next slide, please. And finally, the health board, established in summer 2022, as I mentioned, they sponsored large refugee events, legal clinics, support groups, Q&A sessions, and Olya will talk more about that, especially the websites that they created and the list of providers. Next slide, please. So key takeaways for this presentation. If there's anything I could convey to you, these are what I should be conveying. The first is community members can help you develop a better public health program. We've seen that in our own programming and outside of vaccines and COVID-19. And they can create and share better health education materials that are more relevant to community members. Another piece of advice, find and support organizations already serving the community. If they don't exist, help the community build the capacity to have those organizations. Provide data to justify why you're looking to partner with communities. That data piece is really important in securing good partnerships for us that were that had complementary resources and a shared vision going forward. Trust and respect others' perspectives, experiences, and beliefs. And finally, partnerships take time. Several of these took years to establish. And that's a process that takes a lot of patience, but is worth it in the end. Next slide, please. All right, and I think this is my last slide. So finally, be intentional about establishing authentic relationships with community members. So as I mentioned earlier, involve people in planning. Show you're acting on the recommendations. Even if it's beyond the scope of your project, it will build trust. It'll make it, it'll make you a resource for people that they then trust to ask for advice or help. And that's a really important thing in communities that are closed and mistrustful of government agencies. Hire community members to serve as local coordinators, especially make sure that they're from the community. They have been one of the greatest decisions we've made in our outreach. Give partners the tools they need to carry out their work, like an outreach toolkit, like a provider training. Whenever you hear your coordinators or people doing the outreach asking you for resources, try and put together something that's useful for them. And then finally, recognize mistrust is a significant barrier to outreach in this community especially, and account for that in your work. You may never get over that mistrust, but if you have community organizations that are there helping you, that are partnered with you, you may not need to. You could account for that and still get good information to communities, even if they won't engage with government agencies. That's okay. All right, next slide, please. And that's it. Thank you all. I appreciate it.
Thanks so much, Vadim. We're going to do a deep dive into one of the strategies that Vadim mentioned, which is establishing a community health board. So I'll call on Olga to get us started.
Hello, everyone. Nice to see you. I hope to introduce our organization to you. So please feel free to put your comments and questions in the chat. So Nashi Immigrants Health Board was created by 2 very passionate people, by myself, Olga Hapkina. So I am focusing more on connection people, and with Tamara, she's focusing more on a medical part. So together, I think we are a great team to reach our goals. Next slide, please. So Naша Immigrant Health Board is a registered nonprofit organization founded by people in the community with partnership Washington DOH. Mission: we are partners with Ukrainian and Russian-speaking communities in the Washington state to meet the broad range of health and social needs for our people and advocate through community engagement, empowerment, and connections to resources. Our vision: we seek to understand, support, and empower our community and provide for a healthy future for Nashi, which means in Ukrainian, our community, through the lens of health, equity, and social justice. And on this photo, you can see the first person is actually Tamara, and I'm super happy that she is here and virtually support. Second, myself. The third person is Olena. She's here too and supporting us. Katya, she's one of our volunteers, and I will be talking about her in the next couple of slides. And actually Vadim, who is an idea creator of our health board. Next slide, please. So community assessment needs. We gathered together and decided from what we can start. And the Katina's idea was to do community assessment needs, to actually ask people why and what you want to hear and what you want to learn, and what is the most public topics you have in a health area. Next slide, please. So as you see, we have some numbers of surveys, and we continue to collect them on our website electronically and bringing them to the in a paper format to our events. We can go next. So to analyze the community assessment needs test, we can tell the most biggest problem is the mental health issues, and all our resources and everything what we try to create, we try to focus basically on the mental health during the very hard time for the last almost a year for a Ukrainian and Russian-speaking community in the Washington state. Next, please. So to support our community with the all necessary information, we decided to create several sites. So first of all, we have Nashi Immigrant Health Board websites, where we try to gather all information on necessary information. We have several sections for refugees. We have a section for health. We even post some jobs opportunity for people. We have a box for a feedback, so people can send it to us their question, and we try to answer for them as soon as possible. Also, we create site Metut Info, which is focusing basically for a newer arrival refugees, and it's on a Russian language. And right now we try to translate it to the Ukrainian language and add more relevant information based on time frame. The other website, it's a Vox for School. So many people who arrived and they want to put their kids in a school, they need to translate the medical vaccination record. So this site was created with brilliant volunteers and to help people actually to put their kids in a school. Next slide, please. So we try to share our information, as I mentioned, with our website. Also, we are, for the last year of our operation, we realized that the social media, the best platform where people can get their information. We have a group on Facebook, Instagram, and LinkedIn, and we try to post our content there as well. We try to communicate with people via email. Last year we create podcast with the Radio Continent with the community leaders, and we asking them about situation around COVID and about health care related areas as well. We communicating with Slavic community journal. It's one of the biggest in Washington State, Perspectiva. So we had several articles there as well. The main success, what I can tell right now, it's a community cultural events where we can gather people together and bring our own and bring information. Right now we are working on developing first newsletters where what we can share with our leaders of the community and continue to work on our informational progress. Next slide, please. We are very, very happy and great, and it's very great that we are working with actually MPH student from University of Washington who bring their knowledge and wants to work with us to learn more about public health needs in our community. So thank you for all of those brilliant students who help us to create a content as well. Next slide. So I think and from my experience, the main success is in a collaboration. So you can see that we are partnering with several main districts in Washington State, which is Snohomish and Pierce County. And we are happy that both representatives here in our board, so they're our official board members, which can help us to serve people much, much better. And right now we're in the process to working with the other counties, and hopefully we will have more people in our board for the future. Next slide. I would like to mention that for last year we already got 5 grants, and one of the it's working with DH agency to translate and create the necessary information to support Ukrainian and Russian speaking population. Next slide, please. Also, we are working right now on another grant, which called Welcome US grant. The main idea, we try to look for U4U sponsors for newly arrival Ukrainian refugees, and make sure that the sponsors have all necessary information to help new immigrants. Yes, we are starting to process the website. We're starting to create the toolkits. So yeah, we just started this grant. So hopefully we will finish it in the fall, and we will get more great feedbacks in our community as well. Next slide, please. Yes, as I mentioned before, the social and cultural gathering, the key to open people's hearts and to make basically a friendship with them. Next slide, please. So we organize several health fairs where we tell people about all necessary resources, what they need to support them, starting from health and finishing for even for transportation and work seeking. Next slide, please. Yes, our main focus is to vaccinate people and to break those mistrust between in this topic. Next slide. So we try to have a fun for our friends who come in and attend our events. So you can see several pictures. The first one, we have a Sergei Krutikov. She is one of the greatest clown in our state. So he tried to do some fun stuff for kids. And on the other slide, you see the person who is standing. She is a professional fitness trainer. She's just came several months came from Ukraine and already jumped to this idea to did several free classes for our community. So we're glad that she was on one of our events. Next slide, please. as you can see, we try to do emotional events as well, because during the war, people start to seek relief. And the great relief, it's music. It's a universal language, and singing and just being together and sharing their stories. That's why we try to practice a lot, and we have a great feedbacks, because our community is growing very fast. Next slide, please. Cultural events. People would likely come if they will see and feeling themselves as at home. So our team members try to make everything possible to feel people that they're at home, even here, even during this hard time. Next slide, please. As I mentioned before, our key success, it's collaboration with many organizations. So for last year, we organized either by ourselves or either with collaboration with our organization, 17 events. And I think it's great. And for every single event, we try to bring our resources and make connections to the people. Next slide, please.
All right, thank you so much, Olga, Vadim, and Jasmine. We have about 10 minutes left, and so I'm gonna stop sharing my screen so that we can get to some of the questions that came in through the chat. The first question that came through, somebody had asked about a history of vaccine hesitancy in Ukraine. And so I wonder if some of you can talk about your communities about that history. I think perhaps we went over that a little bit at the beginning, but if you could just elaborate a little bit on sort of that history or why that might be.
So I can speak to that a little bit. Oh, does Vadim, did you have your hand up? Go ahead, Vadim.
Sure. Well, I was just going to answer the question in a little bit, and then Vadim, you can add a little bit more. If we think about the Soviet Union and the kind of the situation of many Ukrainians living in Soviet Union at the time, it differed from folks living in other regions of the Soviet Union. There was always a little bit more hesitancy towards government in the various other states surrounding Russia. The way that my parents and grandparents described vaccinations and the process of getting immunized in the Soviet Union was very opaque, very, very difficult to understand what you're being vaccinated for. There weren't questions asked. There weren't offers made. It was forced vaccination. So getting immunized was just part of your life, and you really didn't know what the results, what you should expect, what the outcomes would be. And obviously, if we think logistically, maintenance and handling of vaccines back in those days was far different. And so, yes, vaccine hesitancy does have historicity, and it does come from a government that no longer exists, promoting vaccines in a much different way than we do today.
Yeah, Vadim, I'm good. Thank you. Yeah.
Thank you. I think it's completely understandable then if there were forced vaccinations that somebody might want more information before making this decision, agreeing to get their COVID-19 vaccine or other vaccines. So I know that you relied a lot on community leaders and community coordinators to help you get the word out about this sort of thing. Somebody in the chat had asked about compensation, if the community leaders are getting compensated or if it's more of a volunteer process. Vadim, okay.
Sure, yeah, the community coordinators were compensated. They were paid for their work, and they were full-time employees for the most part. The other partners in our work group, it really just depended. If they had funding from another source, let's say that they were doing outreach to the community already, they would be part of the work group, but we didn't have the resources to compensate everyone. There were some occasions, like in the example of the provider training, where our partners did end up getting compensated for their work on that. big deliverable. But for the time of the work group, most of that was voluntary. And even in the outreach group, that is as well. I'm sure Wally can speak to the health board, but at least for our example, outside of the community coordinators, that was relatively rare. It was mostly volunteer-based.
Olga, did you have anything to add?
So we're happy that we got some grants and we can also hire people to do translation and create the content. So yes, so far we have 19 people in total in the board, but 5 of them got a salary, so it's great.
Good, that's good to know. We had another question come through from Lily. She says, I love the idea of making a public list of Ukrainian providers. Can you talk a little bit about this process? How did you find them? Did you ask their permission to be on the list? Did you confirm that they had openings at their practice before adding them? So can you just elaborate a little bit on that?
Yeah, so as you can imagine, the gathering of these names was pretty messy given the number of physicians and medical professionals in Washington. And just the scope of the project was a little bit difficult. People move around, people change practices, move out of state, retire, etc. So the list is not 100% correct, probably, but we maintain an upkeep just by physically calling physicians' offices. We call hospitals and hospital systems, and we ask them this is publicly available information, and you can just Google a lot of this stuff and ask offices if they have a physician who's able to provide services. In some of the instances when I called, I did ask about whether or not there were any openings, but because it's so difficult to kind of a physician may have an opening today and not have an opening tomorrow at all, so it may be closed down. The whether or not a physician is accepting new patients is not information that initially in the first iterations it was, but later we realized that these things change so often that it's not practical to have that. So yeah, the process was a lot of phone calls to insurance companies who have this information. There's not a lot of cross-platform communication between hospital systems, between insurance companies. They're not very eager or willing to give out the information about whether or not other organizations provide services in language. Washington does have laws that require translations to be made available in certain instances, over the phone or telehealth. But because people are so much more comfortable speaking to physicians face to face, so much more willing to communicate with people whom they understand, who understand them, that this list has actually proven to be pretty effective. People will often let us know that they've used it or they've given the names out to friends and things like that. And then with that, the upkeep, the ask is that if you call a physician's office and see that so-and-so has moved out of state or is no longer in practice, if you could just let me know or whoever gave you the list and kind of get a peer evaluation, peer editing done that way.
Yeah, I can imagine that took a long time with thousands of folks in Washington state that have come from Ukraine. So I really appreciate you doing that. And it seems that even if the list isn't 100% perfect or up to date, that it's still a really good starting place for people who are looking to get culturally and linguistically relevant care. So definitely a great idea for a resource. Have a few more questions coming in. We only have about 3 minutes left, so we might have time for 1 or 2 more. But Nadej had asked, what advice would you give to programs or projects that are trying to recruit community members for an advisory group? And I'll open that up to anyone.
I'll say try and find someone from the community that you know already that can help you navigate the landscape. That's probably going to be your best bet. If you can't or you don't have anyone, ask around your organization, see if anyone else does have a contact at an organization that serves the community. If that isn't available, look for organizations that are serving the community already. They'll have probably a pretty good network, especially if they're refugee resettlement agencies or other works that serve recent arrivals. So I think I would say those are probably your best first steps when it comes to recruitment. The network is very important. Yeah.
Resettlement agencies are a great idea. Absolutely. Did anyone else have anything to add?
I was just going to echo that and say that, as a state agency, you can put stuff out through your website or your newsletter until you're blue in the face, and it will not be nearly as effective as that direct contact with somebody who's from the community, who the word of mouth contact to really try and get to the folks who might be most appropriate for that.
Yeah, and Olga was showing us the websites, one about the school immunizations and other things that are available in Russian or Ukrainian. And so it's a if folks aren't going to the Department of Health website, they might be going to this other website that's created by the community, that's promoted by the community. And I can see like how important that is to really to invest in that. I'm gonna go with one more question. Oh, it looks like it was answered in the chat. Somebody had asked if NASHI conducted events primarily in Ukrainian and Russian, or if you use English to help with folks looking to learn English. And Olga has responded that you conduct events in Russian and Ukrainian languages. One thing that we recommend at NRC RIM is to print stuff back to back. And so if you're handing out like a flyer in Ukrainian, you might have Ukrainian on one side, English on the other side, or English and Russian, or sorry, Ukrainian, Russian, things like that. And so that you can meet the linguistic needs of lots of different sorts of people. So we only have 1 minute left, so we can't take any more questions, unfortunately, but I hope you'll all join me in thanking my colleagues from the Department of Health and from the NASHI Immigrants Health Board for helping us today learn how we can engage with Ukrainian communities. So thank you.
Thank you all.
Thank you.